Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Euchre. I would like to welcome to the program Meg Healy from Waterloo, Iowa. Thank you for being on the show.
Oh, thank you for having me.
Why don't you tell us, Meg, how you came to be in pain?
Well, it's been over 20 years of pain and just degenerative type symptoms. I've been very active and played basketball. And then, of course, I was a nurse and now a physician assistant. So I'm on my feet quite a bit. And the pain just seemed to be getting worse and worse and wasn't getting any better.
Where on your body did you feel the pain? And was it localized to one area or did it radiate throughout the body?
Actually, there were two areas that were involved. The low back has been a problem for over 20 years. And then the neck area started in 2015, where I was having pain in my neck and in my shoulders. And I'd feel this tightness up around my neck and upper back. So I went to the pain doctor, and he had done an MRI and showed that there was advanced stenosis, spinal stenosis.
What do you do at that time?
Well, I said to him, I don't want a fusion because that's always spelled the kiss of death as far as I'm concerned, where it just leads to an up and down spiral of degenerative joint and disc disease. So I asked him to make a referral to Mayo Clinic. They weren't able to get me in until January 4th. And I was complaining to a friend of mine, Susan Ryder, whose husband, Steve, had had surgery with you last fall. And she said, "You need Dr. Bonati." And I was like, "Okay, give me a location and a number and I'm on my way." So, I am so impressed with your whole organization. You assign a patient advocate right from the first phone call. Lynette helped get me through with all the things that I needed to have prepared to be able to get ready for the visit.
Sure.
I'd sent my MRI of my neck over, and Dr. Kiefer was who was assigned my case. And I talked with him on the phone, and he assured me that they would be, you guys would be able to do something to help with my neck pain.
Right.
And I mentioned to him right at that same time, I've got the same situation going on in my low back, except for that's been going on for 20 years. He said, "When was your last MRI?" And I said, "Well, it was 2015, but I've got one scheduled for Monday." And he said, "That's great because, you just bring that along with you. And I think we can help you with both areas."
And so you make your way all the way from Waterloo down to Hudson, Florida, which is about 40 minutes north of Tampa Bay. Were you on edge at all?
I was apprehensive, but, I had my neurologist look at my MRI. He had said, "Meg, if you fall on the ice this winter, you're going to be a quad." I can honestly tell you that was more anxiety producing than anything that I could have imagined for surgery. That was my impetus to get down to you and to get the help.
What was it like when you were actually face to face with the doctor in the evaluation? Did you feel like they knew where that pain was stemming from?
Oh, absolutely. I've had complete confidence in Dr. Kiefer.
Yes.
And the staff. I was so impressed with the facility. Mercedes was just a godsend with working with my insurance. Getting the appointments scheduled. I had a surgery on Wednesday and a surgery on Thursday. And she said, "And we're going to do your cervical procedures Monday, Tuesday, and Wednesday next week and get you out of here on the 17th of December.
There you go, just before the holidays. So
Exactly.
you kind of sped through the whole procedure process. So let me backtrack you for a minute. We'll put you in the OR. They allow you to watch if you choose to watch, and they utilize conscious IV sedation. It affects everyone differently, but there is always interaction where you're talking direct with the surgeon who's performing the patented Bonati spine procedures. What was that experience like for you?
Oh, that was wonderful. I felt it, an ouch
Sure.
during that first procedure. And Dr. Kiefer was, "I need to know location.
Yes.
Tell me the location of your ouch, And so I was able to do that. I didn't watch the procedure. I don't know. I can do procedures on other patients, but I'm not really keen on seeing it on myself.
That's okay. But hopefully you understand the benefit of the conscious sedation because you're interactive. So you always know what's going on in the surgery and you're not put to sleep only to find out something didn't work.
Correct.
Mm-hmm.
And the thing is, it's so nice to be able to be alert and know what was going on because we could talk through the whole procedure.
Certainly. What were those first steps like post-procedure?
The recovery room nurse said, "We're going to get you up and walk." I thought he was kidding. I don't know where else I thought I was going to go, but
right.
Yeah, it was I had somebody on either side of me for the first few steps, and then I walked. I had a burning numbness down my right leg for 20 years, and it was gone within the first few steps.
Did you think that was going to be the case?
No, I didn't. I didn't. I mean, I was hoping, but I was just going to be happy if the pain in my back was gone.
And so there you are, just steps out of surgery, and already the numbing pain that had been down your leg for 20 years, gone.
Exactly.
And that is the miracle of the Bonati spine procedures. Now, can you tell us, how are you doing this much later, right? How are you doing after your surgery?
Looks like she's at work now. Looks like she's working right now, actually.
And this is my lunch break. It's been really, really good. I have been up, around. I can move my arms up all the way around. I must have told 100 people how happy I am.
Now, when you left, were you told you had to wear any sort of neck or back brace?
No, there was no skilled nursing, no wheelchair, no walker, no cervical collar. Dr. Kiefer had said, he'd had to do a lot of work in the cervical area. And so I was off work for 6 weeks because when I'm seeing patients, I'm seeing somewhere between 25 and 40 patients a day. You got to be ready to rock and roll.
You certainly do. And it sounds like you were doing it and getting right back at it as soon as possible. We love to see the patients regain their strength and get back in motion. And we never tell them to wear these braces. So thank you for sharing your story of recovery with us.
Oh, thank you for having me.
Certainly. So if you or someone you know is suffering just like Meg, tell them to search the Bonati Spine Institute on YouTube. And if you want to find out if you're a candidate, visit askbonati.com. Stay tuned. We'll have more after the break.